Hi, and welcome to the next session of Powbox Secure at Home. I'm Rick Kuwahara, COO and Chief Compliance Officer of Powbox, and really happy to be here today with Paddy Padmanabhan, CEO of Demo Consulting, talking about healthcare digital transformation. And as you can see on the screen right now, Paddy is going to be talking about his findings and his insights from his book. And we're super happy to be able to have a giveaway for attendees today. So we'll be reaching out to attendees if you are a winner of a copy of his signed book, and we'll be in contact with you to get your mailing information. So of course, feel free to ask questions as well as we go through this session. We'll have some time at the end of the presentation for Q&A. So just put that in that session Q&A section of the chat right next to the screen there. But without further ado, I'd like to hand it over to Paddy for his presentation.
Thank you, Rick. Great to be here. Good morning, good afternoon, wherever you may be. Never waste a crisis, as the saying goes. And in this presentation, I will be discussing key themes from my recent book, Healthcare Digital Transformation, How Consumerism, Technology, and Pandemic Are Accelerating the Future. I will share some new research that my firm has done in partnership with industry organizations such as Chime, and provide an overview of the major priorities for health systems today in the industry's shift towards virtual care. I'll talk about digital front doors and patient journeys, and of course, how the pandemic has accelerated digital transformation of healthcare. A little bit about myself. I am the CEO and the founder of Demo Consulting. We are a healthcare-focused digital transformation advisory firm. We work with a lot of healthcare providers and with technology firms that support the providers. You can see my two books on the left over there. I just talked about my recent book, Healthcare Digital Transformation, which I co-authored with Ed Marks, who is a former CIO of Cleveland Clinic. I also host a podcast by the name of The Big Unlock, which is the title to my first book. And the podcast features chief digital officers, CIOs, and other senior executives from healthcare and technology. A little bit of a personal anecdote I want to share with you. I've been a performing musician for a really long time, and during the pandemic, I decided to do a series of concerts on my driveway at my home in Chicago. And you can see that's me over there on the right. And I call these the social distance string concerts. The goal of these concerts was to really get people out of their homes and give them a little bit of relief from the shelter at home and the lockdown of the pandemic. So as you can see on the left, people would come out, they would sit on my lawn or across the street or wherever, socially distanced, of course. And I'd perform for a couple of hours. And it really helped with the emotional health of the community. And that was my little contribution during the times of COVID. So in the first half of the year, most leading systems saw a significant decline in operating income. No surprises there. And this is some research that one did on the top 15 or so health systems in the country. The main reasons for the decline in operating income were, number one, the loss of revenue due to the deferral of elective procedures such as hip replacements, knee replacements, things like that. Increase in costs due to the increased cost of responding to the pandemic, PPE primarily. And then, another important factor, and this one is interesting too, decline in returns from investment portfolios due to volatile US and global financial markets. The last one goes to show that in a margin-constrained environment, how health systems have progressively become more and more reliant on non-traditional sources of revenue, such as investment income. And the outlook for the year is that volumes and operating revenue are going to continue to be impacted by the pandemic for sure. And we are hearing that from health systems that are announcing their Q3, beginning to announce their Q3 results as well. So that's the context and the backdrop. Now, COVID-19 has accelerated the timelines for digital transformation. I hear all the time when I talk to my clients that what was supposed to be a 5 year program has now been accomplished in 5 months. What was supposed to be a 2 year telehealth roadmap has been accomplished in 2 months. And COVID 19 has therefore compelled healthcare providers to think differently about how care is delivered today. The shift towards virtual care is real, and health systems have to develop roadmaps for a digital future. Specifically, technology decisions can no longer be made in a fragmented or a siloed manner and must deliver enterprise level impact. CIOs, I'm saying, are transforming their core IT infrastructure to effectively enable digital health experiences. One new factor that has emerged in the wake of the pandemic is that we went overnight uh, from a campus-based workforce to a largely remote workforce. And this has created significant challenges and new vulnerabilities from an IT security perspective that CIOs and CISOs are now paying very, very close attention to. These charts are from a CEO Power Panel survey that was done by Modern Healthcare in the summer. Uh, as you can see on the chart on the left over there, CEOs are focusing mainly on patient-facing mobile apps and telehealth as a high priority. Again, no surprises there because the pandemic had brought traffic to a complete stop in the hospitals, and so they had to focus on online experiences. Other areas of focus include EHR. EHRs remain very, very important, but EHR systems are not necessarily the systems that are driving digital transformation today, which is what I'm primarily focused on in this presentation. Other areas of focus include AI and emerging tech such as chatbots, wearables, and voice assistants. Now, one thing that has emerged from the pandemic is the need for low contact or contactless experience. Now, think about this. Who would have thought a few months ago that coming in contact with your doctor would be considered a high risk experience? And yet, here we are. So, health systems have had to modify their workflows and enable patients with the technology to be able to get as much of the experience as possible in a contactless or a low contact fashion. So today, you can go online, schedule your appointments, make your payments. You drive up to the clinic will tell you to sit in your car because they've geo-tracked you. And then when your caregiver is ready, you go in, you meet your caregiver, your doctor for whatever you came for. You're not lingering in the lobby or anything like that, and then you're on your way. In many ways, this is going to resemble a drive-through experience. In fact, the quote in the middle there is my quote from that article in Modern Healthcare. Think about it like a Starbucks experience. You pick your drink online, you order it online, you pay for it online, then you drive up and you're sitting in your car, the drink comes out, you pick it up and you're on your way. A lot of healthcare is going to feel like this going forward. And the pandemic has really accelerated this trend towards not just virtual care, but also for low contact and contactless experiences. And what's happening in the marketplace for health systems today? We're seeing that non-traditional players are moving aggressively into healthcare. I like to say that COVID-19 has been a great equalizer. The competitive landscape for health systems now favors digital-first healthcare providers. So all these UFOs that you see in this cartoon over there on the right, they could all have names like Walmart, Walgreens, CVS. These are non-traditional players that are coming into healthcare in a big way. This could also be digital health startups that start with a digital-first model for healthcare delivery. Or it could be big technology firms that are getting deeper and deeper into core healthcare delivery. So for traditional health systems, the implication is that they now have to invest in the technology to develop seamless online experiences for patients, often in partnership with the very same companies, the big tech firms and the digital health startups, that could end up becoming competitors for some parts of their business. So it's an interesting dynamic that is developing in the marketplace. This chart talks about the top priorities for digital health and virtual care. And this is actually based on one of our engagements with a hospital in New York City. And as a part of the digital strategy work that we did for this health system, we conducted an internal survey that covered like 150 executives across titles and across functions. So it was not a small sample, and it was very, very representative. And as you can see here, number one priority, of course, is real-time virtual consults. And this was in the early days of the pandemic, so in early summer, late spring. Clearly, this was a very high need for this health system. But alongside that was also the need to deliver more online access options for patients to be able to access their care. And so the ability to provide patients with online appointment scheduling, as an example, with a provider of their choice, is one of the highest priorities today for healthcare. We also saw that remote patient monitoring is rising in terms of priority. And that is not just in the context of, taking care of patients at home through chronic care, population health management type of programs, but also using that within the context of a hospital or a health system to improve productivity and also increase patient safety. So this gives you a sense of a real life example of what health systems are really focusing on as it relates to their priorities. I want to talk a little bit about digital maturity models here. So if you're a health system, you may be wondering how you stack up against your peers in the industry. Or if you're a technology provider, you may be thinking, who is my right target audience for my product or service? So this maturity model really lays out the different degrees of maturity for health systems in a simple 4-point scale. So at model 1, you're really talking about hospitals or health systems that are focused on leveraging everything they can from their electronic health record systems. So that's what their digital strategy looks like today. Model 2 are the health systems that have gone beyond EHRs. They're looking at best-in-class tools out there. It could be digital health tools, it could be big tech firms, but mostly they're focused on enhancing the patient experience by going beyond the EHR system and bolting on best-in-class tools, very often from the startup ecosystem. And then Model 3 and Model 4 are more mature versions of this. Model 4 really is the most mature, where we're talking about large health systems or leading health systems that are committing significant budgets to multi-year digital transformation roadmaps that not just look at the patient experience, but they're looking at a comprehensive enterprise technology enablement strategy. They focus on one or two key strategic partnerships besides the EHR systems. They're looking not just at the front-end patient experiences, but also at transforming the back-end IT infrastructure. And they have a robust governance model to leverage a startup ecosystem. So regardless of whether you're a health system or whether you're a technology provider, you could use this framework to really understand where you stack up within your industry and where you want to target your attention and your focus for the product or service that you're trying to offer in the marketplace. So we talk about the Agile digital transformation blueprint in my book with Ed. Agile in this context is not necessarily meant to refer to a software development methodology, but it's really about a way of doing business, a philosophy, if you will, and an approach to the transformation journey. Being agile means understanding the transformation is about organization and culture change, and not so much about the technology. Technology is very important, but it also means recognizing the need for organizational buy-in, for building consensus, and importantly, for making changes as and when necessary in order to keep evolving with marketplace needs. And I'll give you an example of my own experience. When Ed and I had completed the manuscript for our book, we had submitted it to the publisher in February, and then the pandemic struck. So we stopped the release of the book. We took a quarter to conduct some more interviews and also observe what was going on based on the work that we were doing with our clients. And we went back and rewrote several chapters in the book, and we actually wrote a new section in the first chapter. This, the fact that we had to pivot in the face of the pandemic in order to make the product or the book more relevant and pertinent for the current context, you can use that as a metaphor for what health systems really went through. They had to pivot in the wake of the pandemic. Those that didn't have a telehealth program had to immediately invest in one because there was no other way to meet patient needs. And there are many other examples of how health systems have had to pivot. But for the most part, what we've seen is that they have accelerated many of the digital programs that they thought otherwise they would execute over a 2 or 3 year period. So the need to be agile is going to become more and more important as marketplace needs evolve rapidly. So you could have a digital roadmap that you may have to revisit every 6 months or so to make sure that the programs that you're investing in continue to remain relevant for the marketplace context. Ensuring strong foundations is very, very important. I often point out that digital transformation is IT enabled, but it's not an IT project. So it's not necessarily IT led either. But ensuring a strong IT foundation is very, very important. And in healthcare, many of you would know that there's a lot of what is known as technical debt. There's a long years of underinvestment. Technology needs to be upgraded, technology needs to be modernized, and new technologies need to be incorporated so that you can support the digital enterprise of the future. That's what we're really talking about here. Ensuring a strong foundation also means other things. Having a strong data infrastructure, data management infrastructure, and driving digital experiences through data and advanced analytics and insights. And all of that forms part of a comprehensive enterprise digital strategy. Today, we're seeing dramatic improvements in technologies and in the ability of technologies to transform care delivery. I'll talk about just a few of the maturing and emerging technologies that are going to play an important role. One example that I like to talk about a lot is voice enablement. It's a great example of how the technology is driving improved patient experience by allowing ambient computing in a clinical environment through voice recognition, and also performing some of the more mundane tasks for doctors, like scribing the doctor-patient conversation and automatically writing it into EHR systems. Other emerging technologies that are rapidly gaining ground include cloud migrations, cloud computing, artificial intelligence, AI, ML, just to name a couple. And then there are others, patient communications is transforming. Now the need of the hour is multi-channel, seamless patient communications. So traditional CRM type systems are now being used to drive some of the more evolved and sophisticated patient experiences of a digital future. Building technology partnerships is equally important. This is a framework that we use. I'll just spend a couple minutes on it, talking very briefly about it. We call this the ICEA framework. The I stands for innovators, the C for custodians, E for enablers, and A for the arbitrages. The innovators are typically your startups that have found an innovative way to solve for a particular problem, or they've found a solution for a previously unsolved problem. A lot of Silicon Valley digital health startups will fall in this category. They'll take one problem and they'll really do an excellent job of solving for that problem. The custodians are your EHR systems. They have the data, they have the workflow. Anyone who wants to work in a hospital context needs to be able to interoperate and work with EHR systems. The enabler category is the largest category of technology service providers. These include big technology platform firms, as well as emerging platform firms that have a platform that customers can configure or customize for their own needs. A great example of this would be something like Salesforce Health Cloud, where they've built out a bunch of functionalities related to patient engagement. Now you go in and you implement it and you configure it for your own environment. There's a lot of smaller companies that are also adopting this kind of a position in the market. And this is the biggest category in the marketplace. The arbitrages are typically consulting firms that have a lot of technology expertise, broad and deep. And in many cases, they will leverage offshore-based resources to lower the cost of development. So India or Philippines or East Europe or any of these locations where you can get great talent, but they're much less expensive than in the United States. So if you're a technology provider, it's important for you to understand where you fit in this competitive landscape, because that will also determine who you need to be talking to in the client environment. And for health systems, it's important to understand the competitive landscape within the healthcare technology vendor community so that they know what kind of attributes they need to be looking for and how to fit them into the overall platform strategy. That brings me to the final slide of my presentation, and this is about getting digital transformation right. This is from my book, and we talk about 7 principles in the final chapter of the book, actually, about how to get digital right. Well, first and foremost, we're summarizing this, and it's as a set of recommendations, but there's a lot of detail underneath it that I invite you to read the book, and you'll find a lot of anecdotes as to how health systems are actually implementing this. This is based on the work that Ed and I did, Ed as a CIO with several leading health systems, including the Cleveland Clinic, which is where he and I actually started writing, getting the idea of writing the book. And our book came out of the collective experience that we had in putting a strategy in place for the Cleveland Clinic. We also did about 150 interviews in the process of writing the book. And of course, the book is informed by a lot of the consulting work that my firm has done. The most critical aspect of driving transformation is to have a digital roadmap. If you don't have a roadmap, you really don't have a plan. And without a plan, you really won't know whether you are doing well with your digital strategy. So leading health systems that we work with not only have a documented roadmap, but they also constantly refresh it, once in 6 months or so. And a lot of the work that we do involves helping them put these roadmaps together, helping them in technology strategy choices and technology partner selection. There are other aspects of getting transformation right. Got to have cross-functional buy-in, governance and processes, best practices. And one thing we are seeing emerging is that digital transformation offices or dedicated digital transformation functions within healthcare organizations that are driving initiatives with an enterprise-wide focus instead of siloed initiatives. And this kind of centralized governance model helps them not only to manage these programs effectively, but also to accelerate progress and be efficient with their investments. It also ensures that technology decisions are being made at an enterprise level and not in a siloed fashion. Digital also needs new financial thinking. When the pandemic hit, I know, we did some work with a health system which did not have a telehealth program just prior to the pandemic. And guess what happened to them? As soon as the pandemic hit, the first thing they had to do was to go out and implement a telehealth platform practically over a weekend, because that was the only way they could see patients. And so at that point, you don't expect them to be, asking questions about what is the ROI on the platform, because you have to invest in the platform, otherwise you're not in business. So digital is going to feel a lot like that if you're in a decision-making role as a digital transformation leader in a health system. A lot of the decisions are going to be based on what is strategically important today, and then you let the returns flow over a period of time. So it requires a new kind of financial thinking about what's important, how to invest today in order to get the returns for tomorrow and to be strategically positioned for the future. Anyway, and finally, you're going to be, if you're a digital leader in a health system, you're going to be constantly challenged to do more with the same or lesser amount of money than you had last year. And there's many creative ways to address this problem, but this is one that the successful CIOs and chief digital officers are able to manage very, very effectively for themselves. And the good news is that they are getting it done. They are accelerating their investments in digital, and they are finding success. You can definitely be one of them. With that, I want to bring my presentation to a close. If you're interested in more research, thought leadership around this, I invite you to visit our website, democonsulting.net. You can download many of our research papers and white papers. And of course, I've mentioned the podcast, and I also publish a weekly newsletter. You're most welcome to subscribe to it. It's a complimentary newsletter. With that, thank you so much for listening, and back to you, Rick.
Thanks so much, Paddy. We do have a few questions. I want to make sure we get to some of them before time's up. First one is, what big impacts does COVID-19 have on digital transformation outside of accelerating the innovation timelines?
Great question. I think in the immediate present, of course, it's dramatically altered the way people work. And one of the big changes, I mentioned two things that have emerged from that. One of them is the fact that the workforce is now largely virtual, and this is completely new to healthcare. Tech sector is used to it. We're all used to working virtually and remotely, but healthcare is used to working on a campus and in a facility. And for them, this change was dramatic. And so in the early days, they had to deal with all kinds of issues, and the good news is that they've largely overcome them. So the issues related to bandwidth, equipment, simple things. Do you have laptops that have webcams on them? How do you get the webcams to them? How do you make sure they have enough bandwidth? VDI infrastructure, and of course security, which is a huge concern. And we have seen incidents, security incidents, because now, obviously, new points of vulnerability have arisen. So that's one thing. And the other thing is contactless and low contact experiences. I think those investments are here to stay. So a lot of technology related to just ensuring that nobody has to touch any surface, right? Facial recognition, palm reading, and so on and so forth. Those are some of the things that are going into the implementation. So this is not really related to, innovation as it relates to delivering care or providing access to care, but this is more fundamentally how you work in a pandemic era. So those are some things that we're seeing.
Great. And these next questions, I guess, are a little related, but maybe first you can talk about what are the biggest factors you see people or organizations using in prioritizing their digital roadmap?
The biggest factor is really about providing access to care when they're talking about digital roadmaps today. You want to make sure health systems across the board, they want to make sure that their patients are able to access the care they need at a time of their choosing and a place of their choosing, including virtual care. So a lot of investment is going into making sure that if a patient comes online to seek medical attention, you're providing them with a symptom triaging tool that can help them self-triage themselves a little bit. You provide them with a chatbot, a conversational interface where you can answer some questions. You give them with a find a doctor tool where they can go in and look for a provider that matches their condition or their needs, give them the ability to schedule the appointment and do it as a virtual consult. All of this has to happen very, very seamlessly. And this is on top of existing modalities. So some patients still like to call in, they want to talk to somebody, schedule an appointment and so on. But increasingly, the need is to create these online experiences so that those who want to get access to care in a virtual mode, they have the tools for getting access to it. So access in general and being able to schedule appointments is a very specific use case. That is probably the single biggest focus that I've seen.
Okay, great. And last question that we can get to here is what helped healthcare organizations adopt technology so fast when initially they had longer roadmaps?
Yeah, somebody asked me this question in one of my other talks. And here's the thing: healthcare, I don't think really had a need to go aggressively into telehealth modalities for a variety of reasons. One of those reasons is obviously tied to reimbursements, right? If you don't get adequately reimbursed for telehealth, you don't have a financial motive to go large scale into telehealth. Now, those that adopted telehealth on a large scale, they had specific reasons for doing so. Maybe they had a large rural population for whom it was difficult to deliver care through conventional means. So you had to adopt a telehealth model so you could cover the population adequately. But barring exceptions like those, for the most part, there was no financial incentive to really push telehealth. Now, COVID-19 came along as a black swan, and I compare this to losing a job. If one of us loses our jobs, nothing focuses our mind more than finding the next job so that you have income. So when COVID-19 hit for hospitals, it was an existential threat because all of a sudden, foot traffic in the hospital came to zero. How do you now take care of your patients? First of all, your COVID patients, to whom you have a great responsibility to make sure that you're diagnosing them right and you're then bringing them in and taking care of them and making sure that your frontline caregivers are safe and protected and so on. So the telehealth adoption became a necessity to deal with the surge of COVID-19 potential infections. But now, even though COVID has subsided a little bit, people are hesitant to go back to the hospital. I don't know about you, Rick, but I'm not ready to go back to a clinic if I have an elective procedure or anything. In fact, I'm putting off my annual physical because I'm not ready to really walk into a clinic. Now, in that kind of a situation, what health systems need to do is really motivate patients to come online at least and take care of themselves. So a combination of all of these factors, I think, has led to them to adopt it. The tech was always there. Make no mistake about it. The tech was always there. The adoption rates were slow, because of a combination of reasons, reimbursement being one of them. Now, of course, reimbursements, the environment has changed and has improved significantly, but it's still not on par with in-person visits. So there's still some unfinished business there, but the gap has been closed significantly.
Well, thanks so much, Paddy. That brings us to the end of the time we have today. But um, really appreciate you sharing your time with us. And again, we'll be giving away copies of your signed book, and we'll be reaching out to the winners in a bit. But thank you again, Paddy. If I really encourage everyone to take a look at the website. A lot of great resources there, and yeah, thanks for joining us today.
Thank you, Rick. Take care.